Okay, we are back today with a discussion on fillers. We got a lot of requests with IGTV when we did one on Botox, we did one on breast implants, breast augmentation. So if you haven't checked all that out, go check out our IGTV and our YouTube to learn all those other little pearls of wisdom. But we wanted to talk about fillers today. And there's lots of different fillers. In Europe, there's like hundreds of them. So this is actually way easier to talk about fillers here in the United States. But first, let's talk about Restylane. Restylane is probably like the oldest of all the fillers. This is in particular is Restylane Lift. That is really made for the cheekbones, and it's made of hyaluronic acid. That's the same stuff that's in your joints. And there's a lot of hyaluronic acid fillers that we'll talk about today. There's Belotera, that's hyaluronic acid. There you go, Belotera. And there's Juvederm. A lot of you probably heard of Juvederm. All hyaluronic acid fillers. And they can be used for a lot of different things. One of the nice things about hyaluronic acid fillers is they can be reversed with hyaluronidase. It's just an injection where that if you feel like an area's got a lump and you don't like it, then you can actually inject that. The doctor can inject it and dissolve that. But starting over with Restylane Lift, the idea with Restylane Lift is great for the cheekbones. Belotera is great for lip fillers and also etched in lines like smokers' lines. You can treat those lines with Belotera. And then Juvederm, you can use that for a lot of different things. Juvederm for the lips, for the lines here, the parentheses lines or the nasolabial grooves. There's a different type of Juvederm for the cheekbones called Juvederm Voluma. There's Juvederm Volbella for the lips. There's all kinds of different Juvederms, all different types of hyaluronic acid fillers, but that's what I'm hoping kind of you'll take away from that is that Juvederm can be used for the nasolabial grooves, the lips, and also the cheekbones. Belotera for etched in lines in the lips, and then Restylane. There's Restylane Silk for the lips, but then also Restylane Lift for the cheekbones. So you can see how it can quickly get very confusing. But the most important thing to remember is that these three here are all hyaluronic acid fillers that can be reversed. And these all last a varying amount of time. Belotera is about 6 to 9 months. Restylane Lift, 1 to 2 years. Juvederm, about a year. Juvederm Voluma for the cheekbones, up to 2 years. So take that for what it's worth. Then the other one I want to talk to you about is Radiesse. Radiesse is different from those three. This is a calcium-based filler. These last up to 2 years. And calcium-based fillers, you can't put them in the lips. They can't be reversed, but they do stimulate collagen. So whereas the Radiesse, you put it in wherever you're putting it, the nasolabial grooves, cheekbones, jawline, you put it in any of those areas, the temple, it will be there for about 6 months, but then it stimulates collagen, and then that effect of the new growth of collagen, that lasts anywhere from 1 to 2 years. So that's a great product for that. Radiesse also comes in 1.5 cc's. The other fillers I was pointing out, those are only 1 cc, so you get a little bit more bang for your buck with Radiesse. And as far as the prices for all these, you can go to our website, realdrbay.com/pricing, and check all the pricing. But in general, Radiesse, we sell it here for $850. Belotera is $650. The Juvederm Voluma is for the cheekbones is $1,000. So again, this is just meant to be a quick summary, but to really get into the details, go to our website, watch some more videos, check the pricing on our website, and you'll get all those details. So hopefully that was helpful.